Welcome everyone for joining us for another one of our free monthly wellness webinars. I'm Dina D'Alessandro, so pleased to have you here, whether you are joining us live or you have registered and plan on checking out the webinar at your own leisure in the recording link. Totally fine either way. This month, we're going to be talking about liver health, and I'll explain a little bit more about that in a second. Other than the last handful of webinars have taken you on a journey of kidney health and brain health. And so I figured let's do the liver this time, and we will go through the whole body system, but I'm going to also have some other things we're going to talk about in future sessions as well, just kind of alleviate from all this anatomy stuff. But in addition to that, July 28th is actually World Hepatitis Day, so I thought that would be fitting. And we'll talk a little bit more, not just about hepatitis, but other liver conditions as well. So once again, thank you so much for joining. I always appreciate anybody who's joining us either live or in, registering and then seeing the recording later. So our objectives for today are what you see in front of you. Liver disease, liver conditions. Liver disease affects approximately 4.5 million adults in the US, and globally, it's about 2 million deaths or complications related to liver issues annually. And about 2/3 of all related liver disease conditions affect men. So taking into consideration, we just finished up with, I think it was Men's Health in June. I thought this was also appropriate here too. And this is a largely preventable situation. Again, as most of things can be, if you know a little bit more in advance of how to treat things and to prevent things. So hopefully you'll learn a little bit more about that too. And of course, we'll talk about food, nutrition, etc., to help you support your liver health. Housekeeping stuff, just a quick note of what to take away and keep in mind, as I'm sure you heard as you were entering into our session today. It is recorded. And the reason why we do that are a few different things. Like I said, we always have a ton of people registering, but not everybody can show up live. So we are collecting the recording for this, and then it goes out after, in a couple of days or so, it'll go out afterwards to everyone's registered. And in a couple of months, I actually make it publicly available on our YouTube channel, the DishWithDina TV YouTube channel. So anyone else who did not get a chance to register for this can have access to it. You can use the chat box at any time, but we always carve out some time at the end of the session for Q&A, even though I usually allow about an hour. Usually these go about 40 to 45 minutes. Even though I am a dietitian, I'm not your dietitian, so please make sure you're only taking this information as educational purposes only. Be sure you're always checking in with your own healthcare providers and getting clearance before you do or take or follow any sort of regimen that relates to your health and wellness. And last but not least, since you are registered, we have your email address on file. So obviously, like I said, we're going to send you, whether you're here live or pre-registered, the recording link for this, and you're also going to be on our distribution list. So aside from getting a survey at the end of this webinar, just to give us some feedback as far as what we can do in the future to improve or other topics that you might be interested in, we also put you on the email list. So right now I'm only doing a monthly newsletter. I don't like inundating too many people with too many things, but you can always opt out if you're like, I don't want to hear from you anymore. That's totally fine. All right, let me introduce who I am if we've never met before. Hello, I'm Dina D'Alessandro. I'm a registered dietitian nutritionist. I work mostly out, I should say, out of New York City. Right now, I'm visiting my mom out of state, so I'm in New Jersey in Ocean County, so I sometimes work out of here too. And I own and operate a part-time private practice. I also am the adjunct lecturer at Lehman College in the Bronx in New York City, where I teach nutrition sciences to the undergraduate and graduate students there. I'm also the campus dietitian at the Student Health Center, so I play a lot of roles in a lot of different things, and all the things that you can see here. I won't go too much into detail, but if you ever have any questions, comments, or feedback, you can always reach out to me on social media or other platforms. I'm known as DishWithDina online. So when we start these conversations, especially when it comes to body systems, organs, etc., I like giving a little bit of an anatomy discussion so you can see what we're talking about. The liver is this reddish colored organ that you can see. It sits in the top right portion of our abdomen area, kind of like underneath, sort of housed behind or underneath our rib cage. And it is what is known as a highly vascular organ, meaning there's a lot of blood cells going on in there. In particular, blood that comes from our stomach and our intestines pass through the liver. So you can see here the terminology you're looking at. Hepatic is the language that comes up. So you'll see that HEPA, that is a prefix that is related to liver. So when we talk about things like hepatitis, that's where that language storage is coming from. And yes, the rumors are true. Liver is able to regenerate or regrow even after some damage, but as I'm sure you are aware and can understand, how much is too much before it can stop functioning in general. Right underneath, you have this green kind of like blobby looking squiggly thing with a little sac. That is your gallbladder. That's in charge of doing a lot of clearance as well. And it's also providing us with bile salts to help us break down fats. And we'll talk a little bit about the role and some issues related to your gallbladder in some of the coming slides. As I was going through all the research, and I mean, listen, I studied this too, but that was many years ago when I was in anatomy and physiology and biology classes and all that. Come to learn that there's over 500 vital functions that the liver performs. I'm not listing all of them. You're just getting a snippet of some of the main ones that are related to stuff that I do. When you see the word metabolism, that just means the processing of something. So our liver is in charge of helping us break down and process a bunch of stuff, things that go into our mouth like food, but also things that go into our mouth like alcohol and also drugs or pharmaceuticals. So anything that we ingest is going through this metabolism process where it's processing through and breaking down into functions of some sort. In the case of food, this is what helps us with turning food into energy or calories and allowing us to function and breathe and move around and move our arms like this. Our liver is also well, we mentioned in the kidney webinar a couple of months ago, liver is similar to it in that it helps detoxify everything too. So it filters our blood, it helps excrete waste products. And as I mentioned in the previous slide with that gallbladder, the gallbladder is also helping with production of bile and storage. And while it's not necessarily part of the gastrointestinal system, the liver and the gallbladder are known as accessory organs because they do play a role in some of the digestive processes that we have, the activities that we have there. Storage, it stores essential nutrients. We have the iron and hemoglobin, so our red blood cells are in there too. We also have what is known as the storage form of glucose. So when we eat and process foods that have a molecule known as glucose or the sugar of food, it turns that into what's known as glycogen, and it kind of does this thing where you can utilize our stores or it can take stores from food and help us with creating energy out of that. Next up with synthesis. So it also has, I didn't put it on here, but it also produces cholesterol. And if you remember from, I think it was back in February in Heart Health Month, we discussed cholesterol in full, and our body naturally produces it. So we don't necessarily need it from food. Our liver will take care of that, but it also produces other things like different proteins and what are known as clotting factors, things that help us stop us from bleeding and heart-related things. It helps carry fats throughout the body too, through, like I said, the gallbladder, and it is tied into immunity as well, so helping us support our immune system. It helps regulate our blood sugar levels. Sometimes we don't realize that that's part of the function there too. A lot of insulin related things are going through these liver functions, and so it's helping us with blood sugar regulation and also cholesterol, as I mentioned before. We'll talk a bit in a second in the sense of when it's clearing things out, especially when it comes to red blood cells. If there is an inability to do so, if there's a backup of something and a buildup of something, then that is what is known as jaundice. So you can see color changes in your skin if there are issues, but we'll talk a little bit more about warning signs in general shortly. Types of liver disease. So as with anything, there's always many, many things that we can talk about. So I've given a handful of typical or common liver diseases that you can see in front of you. I'll clarify a handful of them here, and then I'll talk specifically about cirrhosis and fatty liver disease in the coming slides. And viral hepatitis, I'll talk about that one too. So bile duct disease, again, this is related to the breaking down of fats with your gallbladder. If that is not functioning properly, some of the issues that you might have there and the treatments around that is then having to be conscientious or limit or avoid certain fat-containing foods or using different kinds of oil products that are not going to affect this particular condition. Jumping down to the third from bottom bullet, we have hemochromatosis, H-E-M-E. Heme is the name that we give to iron red blood cells. So if you see something like that, like hemophiliacs, blood-related diseases. So hemochromatosis is the buildup of iron. So we can't excrete it from our body naturally. There's a buildup of it, and it can be kind of toxic. So some of the treatments there is avoiding or limiting certain iron-rich foods, cast iron pans, believe it or not, and sometimes, depending on the severity of this condition, something known as phlebotomy or bloodletting. They're going to drain the blood from somebody to get that excess iron out. The second to last one there, liver cancer. I'm not jumping too far into this because we're going to have a cancer discussion in a couple of months. So I'll talk more about cancer in general. But when it comes to tumors in the liver, that's either known as primary cancer, as if it started there, or secondary cancer, meaning it started somewhere else in the body and then made its way or metastasized to the liver. And then that last bullet for Wilson disease, again, the inability to clear things out so the body is unable to function properly and get rid of excess copper. It's one of the minerals that we actually need in our body to function in different ways. And so in that particular disease state, you might have to limit copper containing foods like chocolate and nuts and shellfish. And like with the iron, you might have to not use copper pots and pans. You have to limit that as well. All right, let me talk a little bit about cirrhosis. This is something that I think feels kind of common or commonly heard, but maybe not a lot of people know what we're talking about when we talk about cirrhosis. We mentioned before that the liver can regenerate and repair itself, but every time it gets damaged, it's building up scar tissue. And just like anything that has scarring over the course of time, if there's an excessive amount of scar tissue on it, it's going to limit the ability of the liver to function. So in extreme cases, this can be quite life-threatening. You need your liver to live and to process a lot of the things. And again, because it's highly vascular, it could also play a role in other things that is related to your blood pressure, your blood sugar, etc. So if you're dealing with a cirrhosis or you're coming at risk for something, you and your healthcare professionals might talk about limiting things like salt and sodium and being conscientious of some of the other foods that could essentially affect what your disease state is there. There might also be a protein restriction too, because like we said, similar to the kidneys, your liver also does some processing of or synthesizing of making of protein, so you don't want to overtax it. And the more common issues here, which we'll see in a second, something known as viral hepatitis and something known as steatotic liver disease, or what used to be known as fatty liver disease. Okay, moving on. Speaking of, so this is what cracks me up sometimes about the medical community, the research stuff that I read about, and also learning about this in my profession. This used to be known as fatty liver disease and then non-alcohol fatty liver disease. And now it has been changed to an umbrella term known as steatotic fatty in parentheses, liver disease. So steata is the term of excess fat. So if you end up having what is known as steatorrhea, that is fatty buildup or fatty residue in your fecal matter, in your stools. So just keep that in mind. Again, I like to always kind of clarify prefixes and suffixes, especially in terminology that might seem a little bit off or hard to understand. But in the case of steatotic liver disease, this is directly related to excessive alcohol consumption. That leads to fatty deposits in the liver. Again, it's an issue of stopping it from doing what it normally functions is, and it can reverse or it can correct itself by ceasing the alcohol consumption. But the more it progresses, the more severe it can happen, and then that particular liver damage can then, go to the cirrhosis issue as well. Next up here, just missed my cursor. Next up here, we have, this used to be known as non-alcoholic fatty liver disease, NAFLD. Now we're using, again, that umbrella term of steatotic liver disease. And now we have a subcategory where you just saw the one that's alcohol related. This is technically non-alcohol related, but it can be alcohol related, as you see from the second bullet there. But this is more related to like lifestyle factors, metabolic dysfunction. So anything that has to do with excess body fat, depending on where it's located, insulin resistance, what we call metabolic syndrome as well. So there's a variety of a cluster of groups that put us in metabolic syndrome conditions, like the high cholesterol or high lipids or abnormal lipids, insulin resistance, type 2 diabetes, etc. So all of that can then turn into this steatotic liver disease related to metabolic dysfunction. With the side note that it's not necessarily excess alcohol in the case of it was the previous slide, but this could also be affected through moderate alcohol consumption. And as I've said before, right, we look at things like the Mediterranean diet as kind of like the gold standard go-to, and that does allow us to have moderate alcohol consumption, which is about in terms of units of measurement, it's about a bottle of beer, a 4 or 5 ounce glass of wine, and or a shot of liquor. So that's what is considered quote unquote moderate alcohol consumption. And this too can progress to cirrhosis as well. Now we come up to viral hepatitis. Anytime you see itis, that means inflammation of something. Hepa, right? We saw before hepatic. So in this case, this is the inflammation of the liver. But it's not just regular hepatitis, which is inflammation in the liver in general. This is related to a virus. So we have viral hepatitis, and I'll explain about some of the more common ones that you see in front of you here. Hepatitis A, hepatitis B, and hepatitis C. Hepatitis A accounts for about 20 to 25% of the states in the US on an annual basis. The cases here, the way that you're contracting this is more along the lines of hygiene and cross-contamination or hygiene issues. And so food, water contamination, and fecal matter. So one of the things that we always recommend is wash your hands and make sure you're keeping things clean and sanitized. Thankfully, there is a vaccine available for that. So if you are aware of some of the things that you might be at risk for, you can always get vaccinated to hopefully prevent that from happening. Viral hepatitis B and C are somewhat related in that they both spread through contact of blood and bodily fluid. So if you are an injectable drug user, or you are sharing needles of some sort, or you are connected to somebody who has the virus already through their blood and that's transposed into you too, that can be an issue. Hepatitis B is about 5 times more infectious and more stable, meaning it's going to cause a lot more problems. So there is a vaccine available for that. If you are at risk, you can always get the vaccine for that. Hepatitis C, no vaccine available there. It's mostly relying on antiviral medicines once you contract that. So a lot of these things, sometimes there's moderate or mild symptoms. Some of these things could be more GI based because, again, it's the liver. It's somewhat of an accessory organ to the digestive system. And so you wouldn't necessarily know things like this unless you're showing some consequences and symptoms and getting tested for something that can determine, yes, you are in fact diagnosed with that particular virus. All right, moving on, story time related to Hep A. When I started my job, before I became a dietitian in 2008, I was working for the New York City Department of Health and Mental Hygiene, quite literally the weekend in February, the weekend before I started my first day there. I'm laughing because I think this is kind of funny in a way, but I started my first day there. They had a hepatitis A outbreak at Socialista. I don't know if Socialista is around or not. I can't remember if the restaurant still exists. It's in the West Village. It's very fancy. There was like the Manhattan Glitterati event going on. If I remember correctly, the details, I think like Demi Moore and Madonna were there. And what ended up happening is one of the bartenders or servers did not wash their hands properly. They're serving food, they're using, ice, and they're serving drinks. And within about 24 hours of that event, the patrons of the restaurant were starting to complain of things like GI issues and low fevers and nausea. And so Department of Health had to deploy. They had an outbreak. So you're not administering a vaccine at that point. You're just kind of riding out the symptoms until they resolve. But what we did was we had to educate them on cross-contamination and hygiene and food service protocols, et cetera. If anybody attended the dining out webinar, I think that was last year, the dining out webinar where I talked about restaurants and adhering to certain food service requirements and the grading systems, things like that are publicly available to understand what's going on. But anyway, the reason why I bring this up is because you would think we've learned lessons and people will integrate this information and be more conscientious and cautious moving forward. But nope, lo and behold, not 5 years later, a different restaurant in the West Village, another hepatitis A outbreak. So my friends, literally, be sure you're washing your hands, especially if you are in contact with food and water and you're distributing to people who are eating at your facilities. All right, honorable mention. So gallstones, again, an accessory to and somewhat related to the liver. Gallstones is another thing to keep an eye out for. This is a deposit or a buildup of these little stones that can form in your gallbladder. Some of it is quite asymptomatic and quite mild, and again, just waiting it out to see if it's going to resolve on its own. And other ones might require some more specific treatments like medications, surgery. So the name of surgery when you're getting your gallbladder removed is cholecystectomy and or endoscopic procedures there. So if you are getting your gallbladder completely removed, because that is related to the processing and the breaking down of fats, you might be put on a low-fat diet or you might be giving some restrictions. And some of the reasons why or the risk factors that we see come up that can put you at risk for gallstones are, as you can see here, high cholesterol, high bilirubin. Bilirubin is just the name given for the excess, the inability to break down the red blood cells. We said blood goes through that whole system in the liver functions, and it's not able to break down or empty properly, and things back up and cause those stones to happen. Now, I made a note here because I honor and respect a lot of different modalities. I believe not everybody likes to go through medications, and that's okay. We have other treatments available for people who might want to take a more holistic approach. So somebody asked me a while back about castor oil packs. So this might be something that you might see come up in infomercials or in maybe some of the more complementary and alternative approaches to medicine. And so what I saw come up with the castor oil packs of what they were promoting is that you apply these packs to the abdomen area. So in the case of obviously your liver or your gallstones, and that the claim is that they could reduce things like kidney stones, gallstones, even ovarian cysts. But as is usually the case, the research that I saw looked through did not back up those claims. So these are alleged claims or anecdotal stories that are coming back to say whether or not they work. So I would just say, as always, just be really cautious and conscientious of anything that you're buying over the internet or anything that's more of like an herbal remedy or things that are not well tested, because we don't know if they're getting regulated or following any kind of standard protocol. We don't want to do more harm than good. This next slide is a bit overwhelming, but like I said, food and drugs are processed through our liver and our kidneys as well. But our liver here is what I'm sharing with you in front of you. Sometimes doctors will prescribe liver metabolized drugs only to people who are suffering from kidney disease because we don't want to tax the kidneys even further. So some of these are just through the liver, and some of them are kind of like byproducts through the liver. So I'm not going to go through every single one just because I don't think I have the time to read through all of this, but I will say not to scare you. It's not like be careful of any of these that you take. It's just be conscientious of. We have something called drug-induced liver injury, and all of these things could play a role in some way. Some of them are very rare. Some of them are a little bit more common. Some of them are only if you're having mega doses or long-term use of a particular drug. Most of these, I would hope, and I would encourage you that if you are being prescribed by your doctor, that you are monitoring it. And I would also hope that if you're buying something over the counter, that you are looking at the label and following the instructions accordingly as far as the dose is concerned. If you remember I think it was last month when we did the toxicities and deficiencies webinar, we talked exactly about that. Just because one pill is good, you don't want to think that more is better, because sometimes you might end up with some severe side effects that do not end well. So some of these are early onset, some of these are late onset. A lot of these can be resolved within a week or a month of stopping the treatment. Again, depending on what your condition is, you might be on long-term medications, but in the case of something like antibiotics, that might be a short-term thing, and then hopefully things will resolve if they notice any increased levels or abnormal liver enzymes when you're going to get tested. So I'll just read through a couple of the ones that I have in front of me. So like something like acetaminophen. Tylenol is the brand name for that. That's an over-the-counter pain reliever, fever reducer. Not toxic to the liver in regular doses, but if you hit, I think it's more than like 4 grams, 4,000 milligrams in long-term use, that can cause liver damage. There's actually a note on the bottle that tells you that, and it gives you a number to poison control. So they are trying to make sure that you are aware of potential side effects before they happen. Antibiotics are very common, right? People with UTIs or any kind kind of bacterial infection, we'll be using antibiotics. Again, this is why we always say it's usually a 7-day regimen and then that course is over and you're done with it. The ones that I wrote down here, Augmentin and isoniazid, were the most likely medications to cause some sort of drug-induced liver injury. Again, long-term use, excessive dosages of that. So being conscientious of what you're taking in and talking to your doctor about that. NSAIDs, those are the non-steroidal anti-inflammatory drugs. Those are things like Advil and Aleve. But Cataflam, which I wrote down here in parentheses, that is actually prescribed through a prescription, through a doctor's prescription. So again, making sure if you're taking something like that, that you are monitoring it and you're going back to get checked on it. I often think, what did we talked about, like the vitamin D deficiency, I think it was in the last webinar with the toxicities and deficiencies, that some people are put on mega doses and then kind of like left on their own, and or they don't follow up to go back and get checked with their doctors, and those things can build up. So please make sure that you are only using what's prescribed and that you are following up with your doctor accordingly, at the very least within a week or two, at the very most within a month or so, just to make sure that there's no elevated liver enzymes that you have to deal with there. Jumping down to, let's take a look, maybe the antifungal medication, diflucan is another one that I wrote down here too, which can be one of those most common causes for liver injury. Fairly rare, but most common in that sense of liver issues. Again, those cases would resolve in about 1 to 2 months once the treatment has stopped. So if you're dealing with fungal issues, then again, that's something that you wouldn't be on, I don't think, long-term regimens for. All right, now I'm going to jump down to the last 3 bullets there. So bear with me as I get my notes in order here, because this is kind of, where I come into play with a lot of my nutrition stuff, and also where I work with people who are on weight management journeys. And sometimes they'll use things like weight loss supplements, or they'll go on detoxes for things, even though we just got done talking about how your kidneys and your liver, if they're properly function, are doing the self-cleaning for you. You don't need to have these detoxes. So these particular products, again, are lumped into those supplements, and supplements aren't regulated properly, and there's not a lot of mandates, rules, and guidelines for them. So they're not going through the same kind of research and check-ins that we do see from our pharmaceuticals. So being really super conscientious before you purchase anything and start using things like that, because just like anything, you're putting it into your mouth, it's going through either your kidneys or your liver, and there could be the consequences. Now I'm going to call out Herbalife here for a sec. And from what I've seen in my research, Herbalife hotly disputes what I'm about to tell you, but this is the information that I found. A while back, there were 50 clinical instances of liver injury documented in medical journals related to Herbalife specifically. Now, I'm calling them out only because they are a well-known brand, and a lot of people do tend to utilize them, pay money for them as meal supplements and part of their weight loss regimens. But again, like I said, it could really be anything. It doesn't have to just be that particular brand name. Certain vitamins, vitamin A, that is a fat-soluble vitamin, so that's already going through your liver and is processing through that. People use that sometimes for skin stuff and eyesight stuff, and in larger levels that can be quite toxic too. Niacin, which I didn't know this, niacin is a vitamin B, B vitamins, vitamin B3. Some people use it for cholesterol lowering, which makes sense because we're talking about the liver. But again, in large quantities or in long-term use, it can build up and it can affect the liver. So being careful, again, even in the kind of like quote unquote natural products that you come across with just vitamins and minerals, those can be an issue. And the last thing with the herbal products, so this black cohosh I found, some people use it for to help manage menopause symptoms like hot flashes and brain fog, but that in particular, and the other product here that I wrote down called kratom, that can be utilized as a natural stimulant. So if people are low energy and they don't do caffeine, they might want to pop a kratom supplement. But those also have been correlated to potentially having issues related to liver disease or liver injury. So not doing this to scare you, just doing this to educate you, especially if you are on quite the cocktail of things, or if you are on mega doses of things and you are not checking back in with your doctor, or you're taking it upon yourself to go purchase things online or in your pharmacy, your drugstore, whatever, and without reading proper instructions. So the considerations here, the information I want to share with you around all this is obviously don't take more than the minimum or maximum recommended. Make sure you're following the instructions. Don't take alcohol, because alcohol is one of those things things that can be detrimental too, or can interact with that. Make sure if you have questions that you're asking your doctor or your pharmacist. And if you are on these mega doses of things like these vitamins or these other pharmaceuticals, that you are checking in regularly with your doctor and making sure you're noticing if there's any abnormal liver values, that then they can either tell you to come off a particular thing, give you a different medication, or maybe adjust the dosage in that sense. Okay, next up, this gave me a bit of a headache, and you're gonna have to bear with me in how I'm explaining this. I put this in here because when it comes to the breakdown of sugar molecules, the foods that we eat, the plant-based foods that we eat in particular, contain a variety of different things. And there's also lactose is a sugar molecule found in dairy products and cow's milk and other animal milk products. But fructose, I feel, gets vilified because people will say things to me as a dietitian, like I'm stopping to eat fruit because I hear fruit's bad. It's really high in sugar. And I'm like, well, yes, but not every fruit is created equally, but also fruit provides us with a lot of good nutritional qualities. So I think the conversation around this really stems from fructose metabolism, which means there's a processing of this particular sugar molecule. So glucose is one of the things we hear of with like diabetes and blood sugar control. Fructose goes kind of bypasses the other pathway, and it can land in or accumulate in your liver. It can convert into what are known as triglycerides. Technically, excessive carbohydrates in general, excessive sugar molecules that you're not burning off, can also package and turn into triglycerides. And if you know anything about triglycerides, it's in the family of cholesterol, and that can play a role in, putting yourself at risk for heart disease, etc. It could also affect blood insulin resistance, blood sugar stabilization, and as you can see, there can potentially contribute to other liver-related diseases because all of this stuff is processing through the liver. Now, that said, this is why I don't really want people to stop eating fruit, because on the left-hand side, you have those more natural products. And obviously, if I were to give you some guidance, I would say opt for the whole fruit. There's fiber in it, a lot of good nutritional value, those good quality antioxidants that protect our cells, the different vitamins and minerals that come from just looking at whatever the colors are, they have different things in them. And so I would say if you want to be moderate with that consumption and prioritize your vegetables over your fruit, that's cool, that's fine. But really the issue is the stuff that you see on the right-hand side. I mean, this is not a surprise to anybody. We're talking about these added sugars. And if you know the term, the ingredient of high fructose corn syrup, that's what we're talking about. The things that are made for these more, what we call ultra processed foods, or these added sugars or sugar sweetened types of products. So if you're going to end up saying, I can't eat fruit, and then you find yourself drinking, soda and eating cakes and cookies, you're really doing a disservice. I believe that all foods fit. There's a lot of flexibility in people's diets, unless you are severely allergic to something, or there's another reason why we want you to avoid a particular ingredient or a food group. But we're prioritizing your whole foods, your fruits and vegetables, and maybe staying away from or limiting or avoiding some of the things on the right-hand side when it comes to the fructose discussion. All right, so kind of like at a glance, the risk factors that potentially could increase your risk for liver diseases or liver conditions. Listen, we age, things go down the pooper sometimes, right? We wear and tear some things, just the changes that come along with that. It is what it is. Other chronic conditions can then affect different organ systems in our body, especially if we're not able to manage them well. And then kidney and liver disease in general, too. Like we said, one thing can lead to another. There's different stages that happen. When it comes to those viral hepatitis issues that I was mentioning in the previous slides, that can be related to cross-contamination or poor hygiene or blood issues, blood transfusions, cross-contact injections, etc. And even things like tattoos and body piercings, if something's puncturing your skin and getting into your blood system. And then, of course, last but not least, one of the more important things is excessive alcohol use. So we'll talk a little bit more about that too in a sec. Warning signs. So as I think I shared earlier, sometimes these are very asymptomatic. You don't know what's going on. Not everybody's going to the doctor every 3 months. So you might not know if you have elevated liver enzymes or abnormal blood tests. But if things progress to the point where it can be a little bit more severe, or you're on that borderline of that becoming a more complex or severe issue, you might see things like you see on screen here. Like we just said, the inability to break down red blood cells, or not being able to process certain things or clear things out of our body. You might start seeing a yellowish color or a lightening of your fecal matter, or digestive difficulties. in unexplained or involuntary loss of muscle mass or weight in general. And again, the not clearing of things, the not being able to detoxify our body. You might notice the taste and smell of your breath a little bit more. In more severe instances, brain impairment and something known as pruritus, which is this itchy skin. You don't have a rash, but you're noticing kind of like a sensitivity to your skin. So I bring all of this up because I don't necessarily tell my clients like you have to track and weigh and measure every single thing that you eat, but I always encourage people to collect data. Every single person is different. All of your environmental factors, all of your experiences, all of the different things that you're ingesting, your habits, etc. You are all so different. So if you note things, you're jotting things down. Like, hey, I noticed my urine was a little bit off one time, or I started noticing a musty smell, or I'm noticing that every time I'm doing something, my stomach hurts a little bit. Just take notes, keep notes of things, try to document or keep a journal of some sort, whether it's food or symptoms. And this way, number one, when you do go to your physical exams, you have information that you can bring with you that the doctor can assess. Or number two, if you're noticing patterns, then maybe you can get to an appointment quicker before something progresses even worse. All right, I'm just checking the chat in here. I think so far it's kind of quiet out there. So thank you. And we'll have some time for Q&A at the end of this, as I mentioned. So screenings and diagnoses, obviously if you're able to go to your regular exams, whether you are going to your primary care physician or you have a specialist, they're taking history from you. As I mentioned, bring a journal with you, tell them whatever you're dealing with and give an oral history or physical information of what's going on. The blood tests that you can keep an eye out for, more common, are the ALT and AST. That's something that's on what's known as your comprehensive metabolic blood panel. So when you go for a blood test, that's usually already in there. You don't have to ask for additional things for liver tests. And if they notice anything in there, I mean, there could be just a small sign of infection or something even worse coming in that you can address if you notice abnormal results from those things. Again, as it gets maybe a little bit of more of an issue that you're curious about, you might get sent to do more imaging procedures like a CT scan, an endoscopy, or a liver biopsy where they take a nick of the liver and decide, to analyze the tissue sample. And this in particular here is really the only way that you can be diagnosed with that fatty liver disease, where they can just determine which category or subcategory you're in there by doing a liver biopsy. Treatments available to you. So what you see here, sometimes, yes, it's as easy. I don't know if it's easy to adjust your diet, but not just adjustments to your diet of, oh, hey, eat more quality foods. But like we said earlier, with some of those other liver related conditions like bile duct disease or hemochromatosis or the Wilson disease, you might have to avoid certain X containing foods or limit or reduce or substitute things that are not going to be processed properly through your liver. Alcohol cessation. I say this every webinar, right? Every time. I'm like, again, I realize the Mediterranean diet. I realize we enjoy having drinks and socializing with friends, but there is really no safe level of how much alcohol is going to cause an issue. And there is so much research out there that not only is it detrimental to so many organ systems, but it's also a class 1 carcinogen. So it can cause cancer. So if you have never drunk, don't. And if you're drinking, I encourage you to stop it. Okay, that's a good way to reduce your risk or slow the progression of something getting worse. The third bullet there with medications, either you're using medications to treat an issue or you're adjusting the medication dosage like we just said earlier because of whatever buildup or potential risk factors for drug-induced liver injuries going on there. The fourth bullet is phlebotomy. That's just the term for bloodlettings. Like I mentioned earlier in one of those liver conditions about the buildup of iron, that might be a treatment that you're going to have to go for if you are diagnosed with that. Managing any complications, and then, worst case scenario, if you are progressing into, in kidney disease, it's 5 stages. In liver disease, it's 4 stages. When you get to the end stage of your liver disease, then the transplant would be probably the only option there for you. Because with kidneys, you have 2, you can live with 1. With livers, you only have 1 and you can't live with 0. All right, let's move on to the next one about prevention. So I'm going to beat this senseless of ceasing drinking alcohol, but also any quote unquote risky behaviors. If you are working with a substance abuse issue or excessive injectable things, just make sure you're going to different treatment centers or using quality products that you're not getting off the street, and being conscientious also of any transmitted diseases in, however you're connecting with other humans. If you are at risk for certain things, like I said before, especially with viral hepatitis, you can go and get vaccinated for those things and reduce your risk, or hopefully not have to deal with that at all. Be mindful with your medications. Make sure you're looking at the labels. Make sure you're checking with your doctors to avoid any toxic levels of anything, and keeping up with getting tested for your blood to notice if there are any abnormal liver enzymes. Contamination, cross-contamination, keeping your food safe, storage. So what was the one that we did? It wasn't, I think it was one of the National Nutrition Month. So at this point, it's probably in the YouTube channel because it's from last year, where I think we did one of the National Nutrition Months. So that's a March topic that we had, and we talked about how to keep your food safe, what the storage temperatures were, where things should, when things should be thrown out. And we talked a little bit about food waste as well in that too. So you can go back and check out that webinar if you want to get more information about how to keep your food safe and avoid cross-contamination, and wash your hands. I mean, you don't have to be 100% sterile. It's good for the human body to get a little dirty, but making sure you're not touching other things or putting things in your mouth or in your eyes or anything that's going to affect you in that way, that can, again, put you at risk for a lot of these chronic conditions, or especially related to the liver. In the next couple of slides, I'll talk about nutrients and nutrition. I'm a dietitian, I might as well throw that in there too, right? Again, not surprising, the good quality stuff, the things that are vibrantly colored. Antioxidants, that just means the cellular protection of the chemical substances that are naturally found in most of your plant foods. Fibrous foods as well. So the hierarchy of fiber can be your beans, your legumes, your lentils, your chickpeas, your avocados, your green leafies, all of those things, on and on and on. And then healthy fats like olive oil, things that, and the healthy fats like fatty fish like tuna and salmon, and nuts and seeds as well. So if you're looking to do meal planning, like this is a great opportunity to kind of check and see what you're eating over the course of this week. Are you doing any summer festivities that you feel like you're not really super in control of what you're eating or touching or putting in your mouth? Just kind of giving a little bit of an inventory there. Try to include as much as you can. I usually say, if you're on a 50-50 split where you're not really in control of your food, see if you can, that can be a goal. Maybe by the end of the year, you do like a 75-25. You're making more conscientious choices. You're a little bit more in charge of what you're making and preparing. It is more whole, minimally processed foods. And this way you increase that nutritional value and that health supportive system there. I do not like broccoli, but I put that picture in there because a lot of people do. But cruciferous vegetables are great, including things like kale or cabbage or Brussels sprouts as part of your cruciferous family. The third bullet, sometimes think about different herbs and spices and herbal things, not necessarily the herbal supplements that I just mentioned earlier, but things like green tea, turmeric, add these nicely, vibrantly colored and tasteful things just to add a little bit more pep to your ingredients, to your recipes, and staying hydrated with water. I also have a note on here too. I didn't put it on the slide, but again, avoiding or limiting the quote unquote unhealthy options, limiting those ultra processed foods, anything with extra added fat, sugar, or salt, these additives that can contribute to liver inflammation, decreasing the alcohol. I already said 1,000 times. And honorable mentions here too, active lifestyle, move around, get that blood and that oxygen flowing in however way that you can. I'm not qualified to give you an exercise regimen, so I'm just going to disclaim that I'm not a personal trainer, but generally speaking, move around as much as you possibly can every day. If you can try to manage stress, very important there too. And if you can get quality sleep, that will also help as well. All right, here I want to just give some rundowns onto some of the more major organizations. I don't have it written here, but we did see in, I think, the kidney disease webinar, we talked about the NIDDK, which is the National Institutes for Diabetes, Digestive, and Kidney Diseases. So they do all of that research there. And I always, right now I'm disclaiming it's not unknown to anybody. There's a lot of stuff going on with just research in general and funding. So I'm getting this information from there. I don't know what the future might hold with some of these studies and so on, but right now you can access information both on the user end, like if you are a patient looking for information, or on the healthcare provider end, and some of these other ones too, like the World Hepatitis Alliance, Liver Foundation, and the global liver.org. As we come to the end, we're almost at our end. Yeah, 45 minutes goes by pretty quickly. As we come to the end of the discussion here, I usually like to ask, what are some of your takeaways? Start, keep, and stop is kind of my three-pronged approach to this. What are things that you want to do, you haven't done yet, that you think you want to implement and start as a goal for yourself? What are things that you think are working for you, pretty spot on, and you want to keep on doing? And then what are some things that are no longer serving you or that you've been saying time and time again, I really should stop, I really should stop doing that, and maybe now is the time to reflect upon that and think about removing that from your life. It's not something that's serving you properly. Before I get to this next slide, I do want to advance and I want you to humor me for a second. So I didn't do this in the proper like APA format, whatever. It's just copy pasted with the links. But on these two slides, I want to share with you, I was talking to somebody recently. When I do these webinars, I quite literally take about 10 hours. I mean, sometimes I work with students and dietetic interns, but sometimes it's just me flying solo. And so I just want to kind of give props to the information that exists out there, both in journal articles and also government sites, and also some of these other websites that I can go to that I feel are legitimate, that I can get quality information, or I can cross-check what I'm sharing with you, because I'm not just pulling this out of my head, and not just because I'm a dietitian, you should, trust me and listen to me, but I'm really trying to go through all of the current research and give you the most current information. So I hope that that's useful to learn and to know about. All right, next up, if you have questions, comments, and feedback, you can always throw them in the chat right now, and I'll take a look in a second before I wrap up. Next month, we're going to take a break from all of this anatomy and physiology and all these big words, because I have a headache too. We're going to talk about something I hope that is fun, breakfast. It is one of the things that I notice people have struggled with. Sometimes people skip it. So we're going to talk about thinking outside the cereal box, talking about just the first meal of your day, how to be more creative with it, why it's important to include something to eat in the beginning of your day if you can. That's going to be on Thursday, August 14th from 12 to 1 p.m. So when you get this recording and the post-webinar link to the survey, in that I always include, do you want to register for the next webinar? You can go and register for that. You can find and follow me online, subscribe, share, tell your friends, anything that you want to do in the Dish with Dina world. I'm always happy to not just gain more followers, but be able to share information that is free or low cost. I really appreciate anybody that thinks this is of use to them. So thank you for being here. I really hope I get to see you again in another webinar, and I don't see anything else in the comment box. So on that note, I'll wish everyone a great day, rest of the week, good summer, and I hope to see you again in August. Bye, everyone.